Imagine a scenario where over 1 million low-income individuals in Oregon are at risk of losing their healthcare coverage due to a financial crisis affecting the state's Medicaid-funded program. This is the harsh reality that the Oregon Health Plan is facing, and it's a situation that could have devastating consequences for the most vulnerable members of society. But here's where it gets even more complicated. The state has recently increased the rates it pays to contractors who oversee care for these individuals, in an effort to prevent them from abandoning the program altogether. The question on everyone's mind is, will it be enough? The new rates, which represent a significant increase from the previous year, are intended to help cover the costs of providing health care to low-income individuals. However, some care organizations are still unsure if the new rates will be sufficient to keep them in the program. The situation is a result of the state's initial failure to provide adequate funding for the program, which led to contractors losing hundreds of millions of dollars. This, in turn, prompted some care organizations to consider leaving the program, which would have disastrous consequences for the individuals who rely on it. The Oregon Health Plan, which serves over 1 million low-income individuals, is a critical component of the state's healthcare system. The program relies on coordinated care organizations, CCOs, to oversee care for its members. However, the CCOs have been struggling to stay afloat due to inadequate funding, which has led to a financial crisis. The state's initial response was to offer a 3.4% average rate hike, which was deemed insufficient by the care organizations. In response, the state has now increased the rate offers to an average of 10.2%, which is still being negotiated. But here's the thing. Even with the increased rates, there are concerns that the program may not be sustainable in the long term. The care organizations are still worried about the state's intentions to reduce funds used to pay providers, which could affect patient access to care. And this is the part most people miss. The situation is not just about the rates, it's about the underlying issues with the program's funding model. The state's efforts to address the immediate challenges are commendable, but they may not be enough to ensure the program's long-term sustainability. As one care organization spokesperson noted, the state's willingness to rethink how the program is funded is a step in the right direction, but more needs to be done to address the underlying issues. The situation has sparked controversy, with some arguing that the state should prioritize funding for the program, while others believe that the care organizations should be more efficient in their operations. But what do you think? Should the state prioritize funding for the Oregon Health Plan, or are there other solutions that could help ensure the program's sustainability? The debate is ongoing, and it's essential to consider all perspectives before making a decision. As the situation continues to unfold, one thing is clear. The fate of the Oregon Health Plan and the individuals it serves hangs in the balance. It's a stark reminder of the complexities and challenges of providing healthcare to vulnerable populations, and the need for sustainable solutions that prioritize patient care above all else.